is you want the money to go out quickly, you want it to be spent well, and sometimes those objectives are somewhat in tension.
For now, closed businesses like the iconic New York City restaurant Cafeteria and Empire Diner have a GoFundMe page for employees.
It's been 2 weeks of sheer financial devastation.
Stacy Pasone says she's had to lay off the entire staff from both restaurants.
Week 2 of this.
Week 2, and how much longer can you sustain this?
Well, you know, it's that's the question. That's the $1 million question, and we really can't sustain it very long.
CNN's Jason Carroll with that report. The coronavirus still has Europe firmly in its grip. Deaths have surged by 655 in Spain, taking the total beyond 4,000. Italy recorded another 712 deaths in 24 hours, bringing the total to more than 8,000, with 80,000 cases. Worries are now growing there that the country's south could become the next hotspot. The BBC's Mark Lowen reports from Rome.
In today's Italy, the essentials are food and solidarity. Local associations buy the basics for those in need. Dozens are taking part, doing their bit to get the country through this crisis.
It's the first time in Italy we live something so hard and difficult, so powerful and difficult situation. So this is the only way for me to help people, something very basic.
They deliver to the elderly and the isolated, acts of kindness to ease the social and economic emergency. For this virus is grinding Italy to a halt. Once buzzing factories forced to close to stop the flow of people. This one of bathroom fittings shuts today. The last of the 130 employees are being sent home. The ovens slowly cooling. The lockdown is containing the outbreak, but it's crushing the economy with it.
Closing the factory has an awful impact. In the current situation, we understand we have to do it to send a message of hope and to slow the spread of the virus, but we can't shut for too long. The economy can't be stopped. If this continues for months, it will be hard to sustain our business.
It's a sacrifice being made for cities like Bergamo, the epicenter, where they blessed the urns of 113 victims, grouping together the fallen. Wearing a sash of the Italian flag is the mayor who we reached. With the UK finally emulating the Italian lockdown, a warning.
Britain had an advantage of being 2 weeks behind Italy with the outbreak. They should have used it better. I'm afraid Boris Johnson lost precious time. There's a risk it could cost many lives. Losing those days could turn out to be a serious mistake.
The containment measures may have started to work in northern Italy, although there is again today an increase in new infections. But concern is now growing in the poorer south and here in the capital, where cases and deaths are rising. In Rome, this hospital has opened a new coronavirus wing, and it's already under pressure. The peak hasn't yet been reached here. With crematoria bursting, the army is clearing coffins away. It's that word again they're more used to. War, man versus virus, and the latter is still winning.
The BBC's Mark Lowen with that report. South African security officials have started enforcing a 3-week nationwide lockdown. The army has joined the police in implementing the measures. The country's recorded more than 900 coronavirus infections, the highest in Africa. South Korea appears to have succeeded where other countries have failed. It's managed to flatten the curve of new infections, and it's done so without China's restrictions on movement and without a large-scale lockdown. Officials believe the country's aggressive tracing and testing regime is working and allowing the most vulnerable patients to get the care they need quickly. The BBC's Laura Bicker gained access to one of the country's intensive care units in Seoul, dedicated to treating people with the coronavirus.
Seriously ill COVID-19 patients need a lot of care. They're on a steady drip of sedation, medication and fluids. Ventilators help supply their lungs with badly needed oxygen. The protective clothing helps keep staff safe, but it also hinders.
It's hard to hear, and your senses get dull. The hardest thing is communicating. It makes you feel more anxious because of it. There is fear here, but I like to just think of them as our patients. And when you think of it that way, it's not that scary.
All of the patients struggling to breathe in this ICU are over 65. They're one of a dwindling number of people who need critical care in the country. The benefits of flattening the curve mean there's even time to smile.
Those who come to the ICU are really bad cases, so it's hard to completely predict whether they will live or not. But when these tough cases get better, it's especially rewarding.
This is the key to saving lives, according to South Korean health officials, staying ahead of the virus by tracing potentially infected patients and testing them. But doctors are worried about a second wave of COVID-19 and say this country needs to be ready.
Can we respond as well as we did in the first wave? Will there be 5, 10 times more patients? I do not know. We don't have immunity. So all countries' scientists should work together to develop a treatment and vaccine.
There's also a new threat from overseas. Thousands of arrivals from Europe and many from the US are now being tested to prevent a fresh outbreak. South Korea may be breathing a sigh of relief for now, but this crisis is far from over.
The BBC's Laura Bicker reporting from Seoul. It's widely believed the COVID-19 coronavirus started as a result of practice in parts of China of eating wild animals. Although it's unclear which animal transferred the virus, bats, snakes and pangolins have all been suggested, it's believed it to have originated from a wildlife market in the city of Wuhan. China is now taking measures to control the illegal industry. Local authorities have launched a mobile app for whistleblowers to report wildlife crimes. In the UK, 670,000 people have now signed up to the National Health Service volunteer scheme. They'll be delivering food and medicine and driving patients to appointments. In the last few hours, cheers and applause have echoed around communities around the country as people went out into the street or onto their balconies to take part in a mass clapping event. They were showing their appreciation for health workers on the front line of the fight against the coronavirus, a sentiment shared by many for health workers here too, I'm sure. And that's World Watch for today. Back to you, Marnie.
Thanks, Annabelle, and that's Midday Report Te Pūrongo o Te Pautūtanga for today, Friday, March the 27th. Stay with RNZ National. We'll bring you the latest COVID-19 update live just after 1 o'clock. Checkpoint will be with you from 5 o'clock with reaction and analysis of all of the day's news. We'll be back on Monday, but for now, from the Midday team, kia pai tō rā whakatā, kia noho tāwhiti, kia ora takitini. And we're coming up to the news now with Kainwyn Curtis.
RNZ News at 1, good afternoon. Ko Kainwyn Curtis Tēnei. The head of the Ministry of Health is giving an update shortly on the COVID-19 epidemic. We'll be crossing there shortly. In the meantime, the Senior Doctors Union says bulk sanitisers are being stolen from hospital walls. The Association of Salaried Medical Specialists says its members have raised concerns about essential equipment needed to fight COVID-19 going missing. The union says hand sanitisers, masks and scrubs are probably going missing from every district health board in the country. The union's executive director, Sarah Dalton, says it's pleading for people to stop stealing. GPs are concerned flu vaccines aren't getting to some areas. Although there's not a shortage of the vaccines in the country, the chair of the Medical Association, Warkworth GP, Dr Kate Baddock, says distribution is falling short. She says the ministry needs whatever possible to get the vaccines out to practices now. The flu vaccine doesn't protect against coronavirus, but will help keep people healthy during the pandemic. A woman whose husband is still working says she's worried he'll bring home COVID-19 and is calling for more information about how to keep safe in their bubble. Maria Sainsbury's husband is a harbour pilot in Wellington.
Kia ora koutou katoa and welcome to this afternoon's briefing. There are 85 new cases of COVID-19 in New Zealand over the last 24 hours. This comprises 76 new confirmed cases and 9 probable cases. There are 37 individuals that we can confirm have recovered from COVID-19 infection. Currently, there are 8 people in hospital with COVID-19. 3 are in Wellington Regional Hospital, 2 in Nelson Hospital, and 1 each in Waikato, Auckland, and Whangarei hospitals. 6 are stable, and 2 patients are in a less stable condition, one of whom is in intensive care. Our laboratories continue to work apace to process and report test results as quickly as possible. And over the last 7 days, we have processed an average of 1,479 tests each day around the country. A reminder, anyone who has been tested and is awaiting their result should be in strict self-isolation until that result is confirmed. Of course, contact tracing continues for all those confirmed cases, and in addition to having additional staff in the public health units supporting that, we have our national operation at the Ministry of Health staffed by a range of health professionals that is increasing each day. We are still seeing a very strong link to overseas travel as well as to confirmed cases, so close contacts of confirmed cases. And there is a small number of clusters we continue to investigate. Those ones are on our website. No additional clusters from those we reported yesterday. So in summary, the combined total of probable and confirmed cases in New Zealand today is 368. Personal protective equipment. There's a lot of ongoing interest in not just our supplies, but the supply chain for PPE. We are just finalising and circulating updated advice to health professionals on the appropriate use of PPE when they do and when they don't need to use it to keep themselves safe. This will be on our website later today and circulated around to the range of workforces that need that advice. That advice, or similar advice, will also be provided for essential workers who may have contact with people in their day-to-day work and just what sort of precautions they need to take, both the use of masks potentially and of course hand hygiene measures. As I've said over the last few weeks, we have a national pandemic supply of PPE, and individual DHBs also have their own dedicated supplies. In the Ministry of Health National Reserve and in stores that are held in reserve in district health boards, we currently have 1.9 million aprons and gowns, 2.7 million pairs of gloves, and 60,000 sets of eye protection. And that is in addition to the 18 million masks that continue to be in our national store, half of which are regular surgical masks, and half of which are N95 masks. On top of that, there's another 5 million or so out in district health boards. The Ministry is currently exploring all existing and a range of new avenues to ensure that we maintain our stock, and we have a range of very productive conversations happening, and that includes working with senior private sector people across New Zealand who have very good networks internationally. All stones are being turned over to make sure we keep our stocks at the levels that will be needed to protect our healthcare workforce and essential workers. 3 days ago, on the 24th of March, the Prime Minister, with the agreement of the Minister of Health, issued an epidemic notice under the Epidemic Preparedness Act 2006. Now, that notice unlocks the use of special powers by medical officers of health under the Health Act 1956 to prevent the outbreak and spread of COVID-19. That's the legal underpinning for the lockdown. And in addition to that, I've issued a national notice to activate Section 70 of the Health Act 1956. And since Wednesday night, that has prohibited large gatherings and required premises to be closed, with the exception, of course, of our essential businesses. There is more information on this on the Ministry's website, and more special powers may be used as the situation progresses, and that page on our website will be updated when they are. As you may know, we've put out a call to retired or currently non-practicing health professionals to support the COVID-19 response should they be required. And there's been a fantastic response there. More than 2,500 have registered already, and that number continues to grow. So as well as retired workers, we've had interest from people who are not currently working in clinical roles. For example, they are on maternity leave, and they are keen to help with the response as well. From today, healthcare workers will be able to register their availability on the Ministry of Health website, and we can then match them to roles that need to be filled in the sector. At the moment, that is particularly assisting with non-patient contact roles like Healthline and our contact tracing service. So in summary, these are unprecedented times for New Zealand and indeed internationally. We are all in this together. As I've said over the last few days, we do expect the daily number of cases to grow. We are testing to find those cases and to take appropriate measures. It will take between a week and probably 10 days before we start to see that number turn around. It will turn around if we keep doing our bit. Modelling shows, and there is a range of modelling out there already in the public arena, that the higher the level of compliance with the measures in place under Alert Level 4, the greater its impact will be on reducing our number of COVID-19 cases, and therefore the impact that will have in terms of hospitalisations and deaths. So I encourage New Zealanders as we go into the weekend may not feel any different from the week, given that most people are at home, but do continue to look after yourselves and your families. Do get some fresh air if you can, and be physically active in your bubble. Look after yourselves, your loved ones and your community. I'll hand over to Sarah Stewart-Black to make some comments now.
Thank you. I'd like to start with thanking everybody for staying home. Staying home, as you've heard, saves lives, and we must continue to do this. We have information from the police that generally people are doing the right thing, but we need for everyone to be thinking and acting more carefully about how they can stay at home to make a difference and save lives. There were some isolated incidents where there were reports of people congregating, and in these situations those people were spoken to and provided with some advice about what the restrictions mean. The government is under no illusions that these Level 4 restrictions, while necessary, have a very real impact on people. These restrictions are dramatic and a sudden shift in how we live, work and interact with each other. If you're struggling, you're not alone. We're working across government and with partner organisations to make sure that people get rapid access to what they need, help with finances, help with accommodation, access to healthcare and medicines, and connection to people in their communities. If you do need help, please reach out. We want to make sure that everyone has what they need to get through in the next few weeks. If you're concerned about someone, please check on them or reach out to government and community organisations who may be able to assist and advise. Please remember that even when we're at Alert Level 4, that the government and other agencies are still open and available to help you. Challenging as these Level 4 measures are, adherence to them is critical. The better we do this, the sooner we can emerge from it. We have a critical window to save lives and make a huge difference to New Zealand's future. As Dr. Ashley Bloomfield has noted, over the coming days we'll continue to see the numbers rise. Hang in there. We know that these measures are the best thing we can do to break the chain of infection. We understand it places strain on you and your families, and the sacrifices that you are making will save lives, and for that we are all deeply grateful. In regards to income support, we would like to reassure work and income clients that regular benefit payments and superannuation will continue as usual. Work and Income are delivering services over the phone and online to ensure clients and staff don't have to have face-to-face contact. While service centres are closed, staff are still working to help clients over the phone, and the government helpline number to call is 0800 779 997. Work and Income will continue delivering essential income support and housing services, the new wage and leave subsidies for employers, and helping other essential services like supermarkets find the workers that they need. In regards to accommodation, the temporary accommodation service, which is run by the Ministry of Business, Innovation and Employment, is up and running. The service is working with other government agencies to assist in providing temporary accommodation to those required to self-isolate who can't do so in their own homes, both New Zealand citizens and people visiting New Zealand. People that need to register with the Temporary Accommodation Service can call 0508 754 163, where a member of our team will help them with registration. The line is open 24 hours a day. There is a cost for temporary accommodation, and the service will work with each individual about how to meet this cost. If you're a New Zealand citizen or resident on a low income or benefit, you can contact Work and Income to see if you're eligible for support. If you're a visitor to New Zealand and need assistance to meet the cost of temporary accommodation, we recommend you contact your embassy or consulate for further assistance and advice. Finally, we know that things are really tough right now, and for people especially who are living with mental illness. If you don't live with mental illness, you may still feel really stressed or anxious by COVID-19, and this is completely normal. Reach out to your other supports over the phone or online, family, whānau, friends and workmates. We also recommend sticking to a routine, such as having regular meal times, bedtimes and exercising. But if you feel you're not coping, it's important to talk with health professionals. For support with grief, anxiety, distress or mental well-being, you can call or text 1737 free, anytime, 24 hours a day, 7 days a week, to talk with a trained counsellor. Please don't hesitate. Thank you.
On the issue of PPE, you listed those there, and it sounds like there's a lot of stock. Is there an issue with getting that out to the country? Is that why people are saying we don't have enough?
Yes, so there are two things about the distribution. First of all, the distribution is designed for when we're in normal circumstances, non-COVID circumstances. So there are distribution networks there. What we want to do is make sure that the distribution has got a national view to it, so that we haven't got stock sitting in one part of the country and another part short. So we're bringing that all into a national process. The second thing is, of course, we are now needing to get PPE out to health workers and frontline workers who wouldn't normally need it. For example, home and community support workers, pharmacies and so on, aged residential care. So we're getting in place the processes to make sure not only that they've got it, but they also know when and how to use it.
You've been doing that already though, because we have had time to prepare for this.
Yes, that has been happening already. It's just we wanting to make sure we've got a really clear national process across that, so that if, for example, a worker doesn't have enough and needs more, there's an easy way for more to be ordered and got to that person.
The nurses are telling us that they'll refuse to work unless they get the proper PPE gear. What's your message to them?
So we've got guidance that's just being finalised and will be on our website today and going out actually through a range of channels to provide advice on when and how to use PPE and when they don't need to use it. I think the key thing here is to help provide some certainty for our fantastic health professionals about what's the appropriate use of PPE. We know we've got it, it's available for them, but we also need to make sure it's being used where it's needed. And so that's what that guidance will be.
That guidance then?
I can't give the details of that, but it will be on our website.
It's not a good position to be in though, is it, if you've got the front line of the COVID crisis refusing to go to work because they don't feel like they've got the adequate protection to do their jobs?
It wouldn't be. I think what I can provide is a reassurance that we have PPE available right for it across our system. We've perhaps ahead of other countries, we've had these stockpiles that have been there just for this sort of situation and for when it's needed. And what we're supplementing that with is advice about when and how to use it.
Tell us about those two cases who are in less than stable conditions. In the ICU case, the ages, where they are and how long they've been ill for.
So the person who's in ICU who is in Nelson Hospital and has been in there for some days was originally not so bad but has deteriorated over the last 24 hours. And the other person is in Wellington Regional Hospital, is still on the ward but condition not quite so stable.
What ages are they?
I don't have information on their ages.
How many patients are currently using ventilators?
The person in ICU down in Nelson is being ventilated at the moment.
No one else?
No, no one else.
An underlying health condition, or is it
yes, they had already had significant underlying health conditions.
The Wellington cluster, the wedding cluster?
Yes.
Can you say how many people in that cluster is confirmed as having COVID so far, and whether you know how it made it to the weddings?
I can't tell you how many people are confirmed in that cluster, but we will update the information on our website around each cluster. What we want to do is try and give a current total and then add to that each day. How did COVID-19 get to that wedding? There's a clear link to overseas travel there.
In terms of the modelling you talked about, you said we won't start plateauing for another week to 10 days. Are we behaving how you anticipated we would compared to other countries with modelling at the moment?
It's a little too early to say, and we've updated our modelling regularly. The most recent one to take into account the decision to move to alert level 4 and that wider self-isolation. And what that does, of course, is defer out quite a long way the growth and any peak there might be if we still determine that there will be a peak. And what is happening at the moment is what we have seen in other countries where you have started to increase, and in particular where we've got still a number of people coming in from overseas, and we're still seeing people coming through the border symptomatic. They're being tested and are positive. So that will also contribate to our increase in number of positive cases for the next wee while as well.
How do you define recovered? Is that just a lack of symptoms, or is it lack of symptoms plus a negative test?
It's someone who has got over all their symptoms and has been symptom-free for a 14-day period.
The Prime Minister often talked about widening the criteria for swabs so that GPs can use their own judgment to refer people. Why then are some people being turned away at testing stations and told they don't meet the criteria even when they've had even when they arrive with a referral?
So it's still a judgment applied by the clinicians there, and not everyone will be tested even if they have symptoms, because there may be a clear other explanation for their symptoms. So yes, there is no limit on testing. In fact, our capacity is now up over 2,000 tests per day. We have, compared with other countries, for example, our testing capacity is on a par with Germany's at the moment on a per capita basis. So we're trusting that clinicians with good guidance are testing the right people. As I've said every day, we want to find the cases, so we won't turn away people who, in the clinician's judgment, think need a test.
A period of a child in the Marist cluster who was there was a positive test on Wednesday, and they were told contact tracing would take place pretty quickly. They haven't had any contact yet. What's the time frame for contact tracing? Is 48 hours too long?
It's as soon as possible. So I'll just go back and check on that. One thing I can say is that because there's been this increase in cases over the last few days, we have had, of course, an increase in the number of contacts to be followed up, and so that is underway, and it always gets underway as soon as possible. What we do is follow up the very close contacts immediately, and they go straight into self-isolation, remembering that many people will identify their close contacts and notify them themselves about what they should be doing until they hear.
In Hawke's Bay? Is one of the new cases in the dementia ward in the Hawke's Bay rest home?
I don't have the details on any of the individual new cases.
Please clarify whether people are allowed to drive to where they want to exercise, because the police commissioner said yesterday, yes, if it's closed, today police officers told a man he should not have driven 5 minutes to a forest to walk his dog. People just need some clear guidance on this.
I think the key message, which has run as a stream through all of the communications, has been about stay local. So if that means you can go for a walk by walking outside of your front door, great. If you need to drive a short distance to get somewhere, that's fine too. The challenge we have is when people might drive themselves to a place that if they get into trouble, someone else will have to come to help them, which exposes more risk. So we're saying just try and stay local if you can. If you're able to walk the dog round the block, it might not be the dog's idea of a good time, but actually, practically, that will work. You don't have to get in a car and drive to do that.
What about with the beach? People who live nearby and can walk there, is that okay? Are they allowed to go in the water? Surf Lifesaving are looking for some clarity around that.
So I'll give a position, and we'll see if Ashley confirms with me that what we don't want is for somebody to end up taking their surfboard out, getting into trouble, and then having to be rescued. And so that's why we're saying about this thing of don't do activities that will require putting others at risk. Remember, treat yourself as if I have COVID-19. What do I do to limit absolute contact with other people? So where you stay local, great. If you live near, across the road from a beach, go for a walk, but don't put yourself in a position where others might need to come and help you and be exposed.
Go for a swim.
Ask yourself that question. Should I be somewhere where I might need help and someone will have to come in and rescue me if you had COVID-19?
Staying local though, how far should people be able to venture from their homes?
I think there's a level of judgment in here, people being sensible and practical. What we're observing is the fact that people are following the guidance, and we're just staying within your local area so that you're with your bubble, you can be out with your bubble, but do it as close as you can to home and keeping that bubble as a complete bubble, not interacting with people.
Cycling, because you might go a bit further afield, or jogging. There's a lot of people out running at the moment. How far can they go from?
I'll come to that. Cycling's great, and yes, you might want to go further and stay in your bubble. Don't go racing off the side of the track and injuring yourself while you're trying to keep 2 metres distance, because bikers tend to pass fairly quickly. But look, I think as Sarah says, it's a matter of judgment.
So you can cycle, but you can't swim. What are some people?
Well, I'm not saying you can't swim. I mean, if it's a nice day at the beach, be sensible, and you can stay separate from others. But what we don't want, it's a lovely sunny day, and 200 families are out on Days Bay Beach. That's not going to achieve what we need to achieve.
There's some confusion about people over 70 who are immunocompromised about whether they're allowed to be out exercising. Is that okay for them?
Well, they should, yes, take exercise. Everybody now is in the same boat as that group who we gave advice to, even at alert level 2, to stay at home. So they should be treated with particular care to ensure that they don't increase their risk.
Just reconsider its shutdown of elective surgeries and non-urgent elective surgeries on a case-by-case basis for people in extreme pain. We've got a case here of a 36-year-old in Whangarei who was supposed to have emergency endometriotis surgery, and she's under 8 on the pain scale, but her surgery got cancelled last minute. Right now, while there's not many people in ICU, would it make sense for a few cases to go through elective surgery?
Yes, it would, and we've had a discussion with the district health boards about that today. Our first priority was to make sure that they were prepared, and they are. There's been a huge amount of work at our DHBs. So what we're talking with them about is undertaking elective surgery where they can do it without increasing the risk to anybody. And so I think that's appropriate. We'll be working with them on that.
Just on the modelling that you were talking about earlier before, you said it would be a week to 14 days. Is that where you see the plateau, and then the number of new cases will start decreasing?
So the modelling, there are sort of two types of modelling. The modelling about what might happen in terms of a peak and when that will happen or not is a longer term piece of modelling. But what we also are looking at on a daily basis is what's happened in other countries where they've applied quite stringent measures, and what you see, for example, in the Singapores, the Hong Kongs, South Korea, Taiwan as a jurisdiction, where they apply it, that numbers do keep going up, and then they start to drop down again.
So do you have an estimate of when New Zealand's peak might be?
Well, they're two different things. We think about 10 days before in this wave of infections we've got, that it will start to go down if everybody does their bit. And then what we need to do, of course, is look and think, right, what are our indications for perhaps relaxing the current alert level? When might we do that? Why? And then we might expect how could we then stop further infections and the number increasing again. So what we're trying to avoid, of course, is a peak. And if you look at some of the modelling, and there's some that's been released and we'll be releasing some more in the next day or two, it shows that if you can avoid that interaction between people and you get high levels of compliance, you can actually avoid a peak. You just maintain it at a low level of infections at which you can manage by contact tracing and confinement.
The indicators that would see you move down from level 4. Are we talking no transmission at all, no new cases for 7 days, no one in ICU? What's the trigger to go down?
We've got a meeting at 3 o'clock today to start looking at that.
It's about the two children that were part of yesterday's confirmed cases, and also has anyone from the rest home in Napier tested positive as far as you know?
So I don't have any more information about the 2 children. I saw that report that there were the 2 children. As far as I know, there haven't been any more cases in the rest home in Napier. However, we will continue to update. I think there's a lot of interest in our updated case-by-case table, which we have refreshed and which will remain on our website.
Mother and student both considered close contacts and with symptoms, were told by Healthline that they didn't qualify for a test. Why would that be?
It's very hard for me to comment on specific interactions, but of course we are constantly giving feedback and updating our advice to Healthline and health professionals about testing.
They were symptomatic and were close contacts of people at Marist College. Should they have been tested?
Well, Healthline has a really clear set of algorithms they use, and it may depend on the symptom pattern, the time their symptoms came on. So I do have confidence that the Healthline staff will be applying those algorithms really rigorously. Perhaps another couple of questions.
Has the Ministry of Health approved any DHBs to release PPE pandemic reserves? If so, how many DHBs, which ones and why, and how many PPE kits?
Wow, so I don't have that level of detail. At the moment, actually, to release pandemic reserves requires an authorisation from me, and I haven't had to make such an authorisation as yet. What we're going to move to, though, is because we know we've got good supplies of PPE coming in, particularly masks again, we will start to rotate out of our pandemic stocks from the start of April and get that out to DHBs to make sure that everyone's got the PPE they need.
Doctors are reporting that PPE kits are being stolen from hospitals. Is there any advice around perhaps beefing up security at DHBs?
Look, security at DHBs is an ongoing issue, whether we're in this situation or not. The report I did read actually was that surgical scrubs were being taken by people, and I just think that's it's really on the nose, and I just don't think people should not be doing that. I would hate to think that we were having to beef up security to protect our staff and the things that those staff might need to actually do their jobs. So I just ask everybody to lean in on that.
Do you have any new information on that Marist College cluster?
I'm sorry I don't, but we will make sure it is updated on our website. Last question.
Will the temporary accommodation service that's been set up or ramped up for COVID, will that cover any New Zealanders who are unable to pay their rent directly because of COVID?
Sounds like one for you.
I think that's an issue that is worth people dialing in on their own personal circumstances, just to be able to work it through about what their needs might be, because it might not be through the temporary accommodation service, and it might be some other support that is helpful for those individuals.
About the quarantine hotels, how many quarantine hotels are you using, and is the Pullman in Auckland one of them?
There are a range of hotels being provided in Auckland, and what we're recognising is the capacity needed. It needs to be greater, so options are being worked through as we speak to explore what those might look like.
Yes, so there's a range of hotels, and in Auckland you will have seen the camper vans as well at the raceway there. So we will get as much accommodation as we need to make sure we can keep people safe, both those people coming in and also other New Zealanders. Thank you very much, really appreciate it, and we'll look forward to the next session with you.